Hey everybody, Jasmine here to talk about Madeleine Leininger's theory of culture care, also known as the theory of culture care, diversity, and universality. Here's just a brief overview of what we'll be talking about today. And we'll go ahead and jump into a little bit of information about the theorist herself, Madeleine Leininger. She's one of the most widely recognized nursing theorists, educators, researchers, and public speakers. She's most well known as the pioneer of nurse anthropology and the founder of transcultural nursing. Her theory today is now a nursing discipline, and it's an integral part of healthcare today. She was a prolific writer and educator and administrator and public speaker. But what I find most interesting and inspiring about her is her incredible dedication to understanding the intersection of culture and nursing. She dedicated her life to studying different aspects of cultural care, and it took her all over the world. That we know of, she traveled to over a dozen countries to study cultures worldwide. She's pictured here among the Gadsup tribe of New Guinea in 1992 when she was there for some research. And in 1998, a few years before she passed away, she was named a living nursing legend by the American Academy of Nursing. Here are some theory and theorist milestones. Leininger was born in Nebraska in 1925 to a German father and Irish mother. So right off the bat there, she was blended in terms of two different cultures. In terms of how she got into nursing, she credits caring for her aunt who suffered from a congenital heart disease for inspiring her interest in nursing. From there, she went on to begin her career in 1945 when she entered the Cadet Nurse Corps at St. Anthony's School of Nursing. She went on to get her BSN and then master's in psychiatric mental health and psychology. And then in 1965, her academic path took kind of an unusual turn. And this unique field of interest is really what set her apart in terms of a nursing theorist. She got her PhD in social and cultural anthropology at the University of Washington. In fact, she became the first nurse to hold a PhD in anthropology and nursing. You may ask, why get her doctorate in cultural anthropology? It's not exactly the typical academic route for nurses. I'll get into more as to what sparked that interest in a bit here. But focusing back in on the theory milestones, in 1974 she founded the transcultural nursing discipline, and then in 1985 she published her transcultural nursing concepts, theories, research, and practice. And then in 1991 she published her theory of culture care, diversity, and universality, and that's what we'll be talking about more today. So as promised, I'll be answering what kind of led her down this anthropological path. So in the 1950s, right after she graduated nursing school, Leininger was working as a clinical nurse specialist in child psychiatry, and she was working at a children's guidance home there and saw some recurrent behavioral differences among the children. She hypothesized that maybe the differences had a cultural base. She noticed that the home was full of children of many different cultures and that the parents seemed to have vastly different cultural expectations. Really sparked a spirit of inquiry in her to where she started to look more closely at culture, and she saw how one size really doesn't fit all, how one approach that works for one client might not work for another. She also saw how that created a distrust of the healthcare system and created opportunities for misinformation and misinterpretation, both of which can lead to breakdowns in communication, treatment, and ultimately patient outcomes. The timing was interesting here. When she was developing her theory, it was around the ending of World War II, in which we saw a lot of immigrants coming in from different backgrounds and cultures, and everything was just becoming more culturally diverse in the US. And Leininger recognized that nurses would need a broader knowledge base when it came to culture in order to provide care that would fit for people of these assorted cultural backgrounds. So that experience led her to become the first nurse to earn a doctorate in anthropology and really precipitated the development of transcultural nursing. It was really a groundbreaking perspective, this blending of anthropology and nursing. It really focused on caring for the individual, not just in terms of their symptoms and disease, but also in terms of their culture and their values and the patterns within their culture. She once said, "Nurses today realize that in the future we will be caring for a more and more diverse population of patients as the world becomes increasingly multicultural." And this really applies to the Christian worldview. 1 Corinthians 14:10 says, "There are doubtless many different languages in the world, and none is without meaning." The Bible really teaches us that all men and women were created in the likeness of God, and as such, every human being deserves to be treated with dignity and respect. Here's her meta paradigm. And I wanted to focus in on her definition of culture. She described it as learned, shared, and transmitted values, beliefs, norms, and life ways of a specific individual or group that guide their way of thinking, decision-making, actions, and a patterned way of living. These are a few of her key assumptions. Essentially, they are as follows. Care is essential for growth, development, and survival. Without care, there can be no cure. That nursing is in itself transcultural. That every culture has generic caring modes, behaviors, or beliefs that are indigenous within its own culture. And that there are culturally universal elements of care. So, cultural competence. This was originally coined by Leininger, but it's now a well-accepted terminology. She described it as care that fits or is sensitive to a culture. She also described it as a constant learning process and an exchange of respect and a willingness to learn. She reminded us that it's about understanding and respecting the values and choices and beliefs of others. And she also suggested trying to maintain a spirit of inquiry and a spirit of respect so that it can be approached as a learning experience rather than an inconvenience. We all know that cultural competence has been shown to increase patient satisfaction, patient outcomes, and decrease bioethical conflicts. Here is her Sunrise Enabler. This is the model that she used to assess culture and healthcare determinants. These are the modalities of care. They form the framework for Leininger's theory. The first is cultural preservation and maintenance. She said, preserve that which functions well, what's acceptable and which is congruent, and then look for accommodation or negotiation where some cultures may need to adapt in order to provide safe and effective care. The third is culture restructuring or repatterning. That's helping people to reorder, change, or modify for optimal outcomes. Here's the definition of her nurse-client relationship. Effectively, it talks about the co-participation of the nurse and clients working together to put together a plan that is culturally sensitive. Here's the significance for us as nurses and as FNPs. The first is in terms of globalization. Leininger really identified a shift from uniculturalism to multiculturalism. Back in the 50s, when Leininger created her model, the world was changing with increased migration, immigration acts were changing, and it really caused a lot of change. And so she recommended that transcultural nursing is crucial as societies shift to a more culturally diverse population. It's also important for us because without this method and this model, it can cause cultural stress for patients and their families due to misunderstandings culturally, linguistically, and likewise, that third one talks about the cultural stress that it causes for nurses. Leininger's theory suggested that if you follow the model, it helps to reduce nurse burnout, culture shock, marked ethnocentrism, and many other nursing stressors. That fourth one is one of the biggest problems caused by a lack of culture care. We know that things can get lost in translation, things can slip between the cracks, and those can impact treatments and interventions. I'm sure we can all think back to at least one time when we had a patient of a different culture that maybe received a different quality of care due to cultural misunderstandings or misinterpretations. Here are the discussion questions, and here are my references. Thanks, guys.